management station for OSCEs. I have Mr. James Matthews. He is 55-year-old male, presented with a recent diagnosis of COPD. Come in.
Hello.
Hello. Please have a seat. Hello.
Hello, hi.
Hi. My name is Shamail, and I'm a third-year medical student. I'm going to be taking over the consultation today. Is that all right with you?
That's fine, Jamal, yeah.
Okay. Can I please first confirm your name and age?
Yeah, so I'm James Matthews and I'm 55.
Okay. And how would you like me to address you?
James is fine.
Okay, James. So do you know why you're here today?
I'm here, I think, to discuss, I've been given, well, people have said to me I've got COPD.
Yeah.
Yeah. So I think we needed to have a chat about that.
Mm-hmm. And do you have any idea what that disease is?
Well, I know a little bit about it. I know that smoking's probably not helped. It sort of, there's a bit of damage to the lungs and I get a bit short of breath.
Yeah.
Yeah. I don't know much else, to be honest. I don't know anyone who's got it.
All right. Well, COPD stands for chronic obstructive pulmonary disease. You know, this seems a mouthful of a word, but it basically means that your airways are narrowed, which makes it difficult for you to breathe. Okay?
I can definitely feel that.
Yeah. Okay. So this causes like persistent narrowing of your airways, and also it causes some inflammation that occurs in your lungs, and this basically gives you the symptoms of shortness of breath, and also as a coping mechanism your lung starts to produce more mucus, and that's the gooey substance you feel at the back of the throat in the early morning. Do you get that in the morning?
Yes, I do. I usually have a bit of a cough and a bit of phlegm.
Yeah. Okay. This is all caused by the inflammation and the narrowing that's happening in your lungs, and also your lung cells are being damaged because, as you said, from the smoking.
Yeah. No, that makes sense. Thank you for giving me a bit of an explanation.
Yeah. Okay. So COPD is mainly caused by smoking, and it can be caused by other stuff like the working environment and exposure to lung irritants and air pollution, but I think in your case, because you're a smoker, it's mainly caused by smoking.
Yeah, I mean, in fairness, I was a gardener, so I was usually out. I can't think of any reason through work why I would got it. So
Yeah. Okay. All right. Do you now understand the disease more? Do you need more explanation?
No, I think I'm fine with understanding it. I was just wondering what should I be doing about managing it, because I really do feel short of breath, and it's difficult keeping up with my grandchildren and things. So
well, as you might be aware, COPD is a long-term condition, okay, and it can get progressive over the years if we don't manage it correctly. And the first step in managing this disease is to stop smoking, actually.
So
how do you feel? How do you feel about that?
Not too good, to be honest, because I find I've tried a few times in the past, and whenever I have, I felt shocking every time I've tried. I mean, I've not felt the greatest just because of the lockdown anyway.
Yeah.
So to then, I don't feel too excited about the prospect of having to do that, to be honest.
Okay, that's understandable, but I need to explain to you the dangers that it could lead. Like, right now you have COPD, and this is a very serious condition, and it caused an irreversible damage to your lung cells, okay? And in order to stop this damage from going further, you need to stop smoking to help the lung cells that are already healthy, to prevent them from getting also damaged. So quitting smoking can really slow the progression of this disease, okay? okay, and helps it not getting worse or bad.
So what you're saying is that quitting wouldn't cure it, but it would stop it. It would slow it down getting
yes,
worse.
yes,
Okay.
yeah. So how do you feel about that?
I mean, am I likely to get worse if I carry on smoking?
Yes, yes. I mean, we are going to give you medications to help with your symptoms, but those medications will not like prevent the disease from progressing. They're only going to manage your symptoms, really.
Okay. Yeah,
Yeah.
it does sound like it's something I'm going to have to start thinking about then.
Okay. Have you tried any alternatives to smoking, like the nicotine patches or anything?
No, to be honest, and that would
Okay.
maybe make it easier, because I just tried like stopping totally before, and that did not work at all. So
Okay. All right.
yeah, I'm gonna have to look at something. Is there anything you could?
I can
help with?
offer you. There is a smoking cessation program we do. I can refer you to that if you're interested.
Yeah, because I'm getting quite worried about keeping up with my grandchildren, and if this is going to go downhill much more,
Yes.
then I'm going to have to start thinking about it. So yes.
Okay.
Okay.
So how many
I'll try it.
grandchildren do you have?
2.
Okay. All right. And how old are they?
5 and 6.
Okay. All right. Yeah. Okay. So before I go into the management, can you tell me if you have any past medical history?
No, I mean I've had a few broken bones and things, but otherwise I've normally been all right.
Okay. Right.
Until
Do you
the
have?
last few years.
Okay. Do you have hypertension, high blood pressure?
I've not been told I have. No,
Mhm.
I don't. I think my blood pressure's alright.
That's fine. Okay. And diabetes?
No, not diabetic.
And are you taking any medication currently?
Or actually, I should have said I get a bit of reflux, so
Okay.
omeprazole.
Yeah. Yeah.
Yeah,
Okay. All right.
that's pretty well controlled.
Okay, that's great. Okay, so I'm going to discuss with you some medication options that you have. We have something called a bronchodilator, which is called salbutamol.
Okay.
Do you know the blue inhalers, the Ventolin inhalers?
I've seen them because I know a few people who are asthmatic.
Yeah. And do you know what do they do?
Not really, to be honest. I know it just people take a few puffs and then it makes it easier to breathe. Sort of
Yes, yes.
thing. Yeah.
Well, how it works, that it acts on the lung airways, okay, and helps widen those airways so that more air can come in and air come out, so it's easy for you to breathe. So it mainly managed symptoms of shortness of breath.
Okay.
Yeah.
Yeah, I'm certainly
Okay.
feeling that. Yeah.
Okay. And we have another thing called a corticosteroid, but we're going to give it in the form of an inhaler, and this is going to help reduce the inflammation in your lung. Yeah.
Okay. Yeah.
Mainly acts on the lung cells and help in the inflammation. Helps
Okay.
dampen down the inflammation.
Yeah, if it helps, I'm willing to try inhalers. So
Yeah.
that's all right.
And how about your cough? Is it bothering you? The sputum?
It's all right at the moment. I think I occasionally have periods where I'm pretty chesty,
Okay.
a lot of phlegm, but it's not too big an issue at the moment.
Okay, because we can offer you something called a mucolytic, and this basically helps with the mucus and helps you get rid of the cough and the mucus. If you'd like to try that out.
Yeah, but when I do get chesty, it's pretty annoying. So
Yeah.
that would be something to consider. Yeah.
Okay, all right.
I'd like to think about that.
Okay, so do you have any questions about what we've discussed about the management?
I don't think so. I mean, you said it could get worse if I carry on smoking.
Yes.
So sounds like I'm going to have to think about that.
Yeah.
Is there anything else I should be worried about particularly with it? Does it cause lung cancer? I don't.
Well, there is a small chance that people with COPD can develop lung cancer, but we are not sure about that.
Okay.
So we mainly want to manage the disease from progressing to anything harmful and the need of continuous oxygen and so on.
Yeah.
Yeah.
Yeah, I don't want to be rigged up to an oxygen machine if I
Yeah.
can help it. So, okay. Yeah.
Do you have any other worries and concerns?
Not really. I mean, I just want to sort of start trying medication, get under control, and
Yeah.
and if I have to stop smoking, then I'll give it a go at least.
Okay, alright. Okay. And so do you have any question at all?
No, that's fine. Thank you.
Okay.
Thank you very much.
Well, thank you, Mr. James. I hope you have a good day.
You too. Thank you.
Thank you.